Welcome to today's webinar hosted by eLotus and sponsored by Evergreen Herbs. We are your trusted source for quality CU content with over 20 years of experience in providing educational courses. My name is Donna Chow, your host and moderator for today's webinar. Our goal is to help you enhance your knowledge and expand your skill set. Today's class, From Novice to Pro, Using Modern Formulas to Excel in Your Practice, is sponsored by Evergreen Herbs and presented by Dr. Sayori D'Souza. This webinar is part of our series of new herbal CU webinars for the year. Chinese herbal medicine often doesn't receive the attention it deserves in TCM healthcare. Therefore, we hope that webinars like this will help both experienced herbal professionals hone their skills and beginners embark on their professional journey. Today's webinar brings together three distinct groups. Our first is our Watch It Free participants with complimentary access. Our second group is our paid group for the webinar. These are our paid members, and you paid for today's webinar, and you can earn CU credit. And the ultimate access, our third group, are Gold Pass members who can enjoy full access to live webinars, distant learning courses, and a library of over 3,000 hours of clinically relevant content. All participants, regardless of the group, have free access to the recording for a month, while Gold Pass members retain access as long as they're members, making it a valuable resource for continuous learning and patient care. If you're familiar with the eLotus Gold Pass, it's your ticket. If you're unfamiliar with the eLotus Gold Pass, it's your ticket to the ultimate learning experience with access to 200 plus eLotus speakers, expertise from 30 years of seminars and webinars. Explore Master Dong's acupuncture, Dr. Tan's balance method, Chinese acupuncture, Tui Na, Guasa, auricular acupuncture, abdominal acupuncture, and more. Over 3,000 hours of webinar recordings are available for you to enhance your patient care. Normally priced at $1,500, today we have a special offer for you. Get the eLotus Gold Pass at just $999, and our sponsor Evergreen Herbs will give you that exact amount back as the store voucher to try their most effective line of herbal products. Yes, you've heard right. This means you get unlimited CEUs, 3,000 plus hours of video recordings, and almost $1,000 worth of Evergreen Herbs for free. If you're new to using herbs, this is the perfect opportunity to learn for personal and family use. And if you're already using herbs, it's a no-brainer. If you're currently a Gold Pass member or use Evergreen Herbs, please share in the chat how you benefit from the Gold Pass and how you feel about the efficacy of Evergreen Herbs for your patients. All right, guys, so the class today, it's going to run from 10 to 2 p.m. Pacific time with one break. Before we begin, let me highlight some important Zoom features. First, we have the chat room. It's an excellent tool to connect with your colleagues who are also attending today's webinar. We do encourage everyone to set your chat preference to everyone so everyone can be part of the conversation and see what you're typing. Next, we have the Q&A box where you can ask questions directly to our speaker. Please limit your questions to relevant topics to ensure an organized and effective session. And lastly, for those eligible, the CU quiz will be available on the following workday, and I'll send an email to you guys when it's available. Our speaker today is Dr. Sayori D'Souza, a licensed acupuncturist physician and a diplomat of acupuncture and oriental medicine certified by the NCCAOM. She is also an American board certified herbalist. Dr. D'Souza incorporates TCM and other natural therapies into her patient-centered approach to treating various common issues. Sayori is passionate about herbology and the healing power of nature, driving her belief in the body's inherent ability to heal itself. As a practitioner, Sayori's role is to facilitate and enhance the healing process by identifying and removing obstacles to health and recovery, and supporting the creation of healthy internal and external environment for her patients. Let's begin and welcome Dr. Sayori. Sayori, go ahead and feel free to share your PowerPoint now with the class. Thank you so much.
Hello, everyone. Can you hear me?
Yes, loud and clear.
Perfect. I first would like to thank everybody involved in this process. I want to thank Tina and John Chan for inviting me to do and come to this webinar. And also would like to say thanks to Donna, Rena, and Sam. They helped me a lot with everything that's going on now. And the most important part, I want to say thank you for everybody that is attending the class today. It's an honor and a pleasure to be here to share a little bit about what I learned lately. So what we can see here, just 1 second. Sam, can you check for me if this is in a full screen? I still see something.
Yeah, it's a full screen. We still see a full screen.
Okay, because I'm having trouble. Okay, here. Let me see. Let's start a little bit with Seed of Health. Seed of Health is the name of my clinic. And Seed of Health comes from, is actually a dream coming true. I decided to do a career change when I turned 50 years old. So when I was going through the master degree for Oriental medicine, I was learning so much that I thought to myself, you know what? This needs to be shared. I need to tell everybody that I can, everything about what I'm learning. It's so fantastic. It's so much information. So one thing that I remember telling to myself during the class is, I want to share what I'm learning. So today, being here, it's definitely a dream coming true. Sayuri, I am an Oriental medicine physician, and I am the owner of Seed of Health, a Oriental medicine and functional nutrition clinic. Why I'm saying this? Because of that. I want to know from you guys, how do you present yourself to your prospect patient? If you can, put in a chat. Let me know what it's showing in your business card, your title. What is your title in your business card? You can put on a chat. Okay. Perfect. Licensed acupuncturist. Licensed acupuncturist. Okay. Great. So let me show you guys. Yes. Let me show you guys what I had on mine. Where is it? Here. Why I did this? I want to show you guys 2 business cards. This one on the left is the one that the first one that I did. And it's exactly what most of the people will do. AP, Diploma of Oriental Medicine. But later, I need to do more business cards, and I decided to change. And I put AP, Oriental Medicine Physician. So why that happened? This is a reflection of my experience from my practice. I started thinking that what I was doing is much more than just being an acupuncturist. And why is that? Because I started using a lot the herbal medicine. And herbal medicine is one of the parts of Oriental medicine. So, and I was not only doing that, I was doing acupuncture, Oriental medicine, acupuncture, herbal formulas, diet guidelines. I was doing electroacupuncture, I was doing auricular. So I was doing much more than only acupuncture. So I wanted my patients to know that I was doing much more than that. So this is why I added Oriental medicine physician. So why is this so important? I used to say that we need to be prepared for what I call the 30 seconds elevator pitch. We need to be ready to tell the person that we are meeting at the first time what we do in a really quick way, using few words, but we'll describe exactly what we are doing. So first thing that we need to think about it is how we present ourselves. This is the first thing. But the second part is how you present your practice. What do you do in your practice? Which kind of words you use about your medicine? Because we need to remember that the Oriental medicine is a natural medicine, and we are different from the other kind, the allopathic medicine. So I start playing with the words and using natural medicine, alternative medicine, holistic medicine, traditional Chinese medicine. So I was playing with words to figure out the best way to present myself to the people so they will know from the beginning what I have to offer to them. And those key words were really, really important. The next point about working with herbs and being a Oriental medicine physician or a Oriental medicine practitioner is to know how you feel about herbs, because our goal today is to help you guys to use herbs and herbal formulas with more, feeling more comfortable with that. But for that, I need to understand how you guys feel about herbs. You want to put on a chat for me and let me know a little bit, just with a few words, what herbs or herbal medicine means to you. Great, Christy. Healing while you are at home. Perfect, exactly. Effective, but difficult. Perfect. I love herbs. That's it. I love herbal medicine. That's it. This is what I want to hear. We really need to love the herbs. Why I would say that? During my master degree, I remember I struggled so much with herbs, and I think that I was not the only one. Herbs is not something easy to learn. We need to, I think most of the people will struggle with herbs. It's something totally different for us. The pinyin sometimes, most of the time, doesn't make any sense to us. Learning herbs is really hard. So even when we feel that's really hard, we need to really love and trust what they can do for us. This is the first thing. This is what I think that made the huge difference for me. Because English is not my first language, Chinese neither. So learning herbs was really difficult. But I always kept in my mind, I love that. I know that they work. I want to learn them. I want to use them on my practice. The entire time I keep telling that to myself. And this is exactly what happened, guys. This is exactly what happened. When I started my practice, I knew that I want to use herbs, but I knew that I need to learn still a lot. So I know that most of you guys know about that already, but I want to go over this just to remind me. We learn Chinese herbal medicine extensively in California TCM schools, 5-branch alum. Yes, I know that, Lara. It's beautiful the way that you guys learn there. Some states, they will not have herbs as something that you must do. Other ones is an option, other ones you don't have the option. Here I am in Florida. So here in Florida, we don't have an option of not doing, thank God. We do the herbs at the school during the master degree. So we need to learn all that. So what made me think that the Chinese herbal could be something that I can really use in my practice? The first thing that calls in my mind is the holistic approach. This is major for us. Our medicine is different from the allopathic medicine exactly because we treat the root cause of the problems. This is the major thing. What we see in other kinds of medicine is they will be treating the symptoms, but Chinese medicine herbal formulas can treat the problem from the root. So this is one of the most important things for me about the herbal formulas. Another thing that is important is the fact that we can personalize that. So we can choose a formula that is specifically for each kind of individual. You will see through my presentation that there are, for the same symptoms, we can use different kinds of formulas. But why this is so beautiful? Because we can choose a specific formula for a specific constitution and symptoms. This is special. Fewer side effects. That is really, really important. Why? One of the biggest complaint that I see in my practice is patient coming from other allopathic doctors saying, I tried everything, I'm tired of the side effects, this is not working for me, I am getting other health problems because of the side effects, I'm looking for something different. That's it, guys, this is what I mean. We have that different thing. We have something that has fewer side effects and can really help people. So this is something important. Everything that I'm telling you about the benefits of the Chinese herbal formulas, those are things that you can be telling your patient when you are explaining to them about the Chinese medicine. Another thing that is important, combination of multiple herbs. There are some kinds of patients that they use herbs already. For example, where I come from, that is Brazil, we use a lot of herbs there, but it's in a different way. They use single herbs for specific symptoms. With Chinese medicine, herbal formulas, we will use a combination of herbs. And this is really, really important too, because people need to understand that using only one herb sometimes will not do the trick, because as we know, okay, Michael, American board certified, yes. So as we know, the herbs, when we combine multiple herbs, we can get much more from them, because when we are creating the herbal formulas, we are combining formulas that can do different things, and with that we create a balance instead of using only one kind of herb. For example, if we decide to use one herb that has a cold in nature, can help with some specific symptoms, but if we don't do the correct dosage or the correct usage, we can create an imbalance in the body and create too much cold in it. Another thing that is important is the versatility. We can work with so many different conditions. It's amazing how much we can do with the herbal formulas. Sometimes most of the patients, when it comes to me, they think that herbal, when they know about the herbs, they will think that the herbs are only for pain. And this is so interesting, because this is, most of the people, they don't know, most of the patients, they don't know about the herbs. The ones that know about it, they think that the herbs is only for pain. And this is another thing that is really important. We have herbs for so many different conditions that when I tell patient will come to me for a consultation, consultation, and they say, I have shoulder pain. And during the consultation, they will say, oh, I also have some GI problems. I have acid reflux. And I would say, okay, we can treat that with herbs. And they would get surprised that, what do you mean? Do you have herbs for heartburn? It's yes, I have herbs for heartburn. I have herbs for menopausal problems, for menses problems. So this is another thing that is important to tell the patient, that we have herbs to treat so many different conditions. This we know very well, long history about the use of the herbs. This is what I think that this is one of our best treasures. We can trust them. We know that they work. And working with a company that you can trust to, it's even better. Integration with other therapies. Herbal medicine is just one part of Oriental medicine. So when we have herbs, we can also use acupuncture, we can do dietary changes, we can do lifestyle modifications. So I used to say to my patients that herbal medicine is just one of my soldiers during this battle of winning or solving any kind of health issue. So we can do herbs in conjunction with other kinds of treatments. It's not the kind of thing that we can do only one thing. We can combine with other ones. And this is great. For me, it's like they complete each other. This is another interesting thing that I want to share with you guys. Online Chinese medicine consultation. It's so interesting because when I tell patients that I have the online consultation, they will always ask me, how can you do acupuncture online? And this is when we have a chance again to explain to them that Oriental medicine is much more than acupuncture, that we have the herbal medicine. And I can tell you guys, I do a lot of online consultation, telemedicine in my clinic, seeing patients in other states. And it's pretty interesting to be able to solve problems, health problems, using the herbs. And because it's like that, it's okay, we don't have the acupuncture. But if you think about the branch that involves acupuncture, involves the Oriental medicine, we have so much to offer to them. And the only one that we can do it online is the acupuncture. So herbal medicine helps a lot with that. Talking about the online Chinese medicine consultations, let me go over little things. Let me ask you first this. How many of you guys, let me know who is doing online consultation already? Put in a chat for me if you are if you are doing online consultations, if it's something that you are doing already. Okay. Yes, nutrition, herbs, and yes, mindfulness. Perfect, perfect. That's it. This is exactly what we can do. And this is what I want to motivate you guys to do. How can we do that? Definitely use secure and reliable platform. We are in the medical field, so we can't do that through Zoom. We need to have a secure and reliable platform. We need to gather patient information because we don't see the patient. Actually, we see the patient through the camera, but patient is not in front of us. So it's really important to get the most possible information Oh, okay, Donna, thank you. To gather the most information that we can have. Visual assessment, I always ask the patient to send me a picture of their tongue. Since we cannot do the pulse, I ask all the patients, online patients, to send the tongue to me, the picture of the tongue. Like I said before, we need to have a detailed case history and the symptoms analysis. So to give you guys just an idea, my online consultation for Oriental medicine lasts 1.5 hours because I need to really explore and ask a lot of questions to understand what's going on with the patient and their health history. Ask about lifestyle and habits, prescribing herbal formulas and sending by mail. This is what happened. We can send the herbal formula by mail. Lifestyle and self-care recommendation, I always do for this for all my patients. Doesn't matter if it is for online or in-presence consultation. I always do that. Follow-up and monitoring, I always do that too. Doesn't matter if it's online or not. It's really important, but for online is even more important. And definitely, I think that I saw one question. It passed really quick, but somebody asked about doing the online consultation for other states. So you need to check the legal and ethical consideration about that. Still in your state, if you can do that. Ask for pictures of their ears. Perfect, Ethan. That's another way to do it. The questions, the comments are going really quick. We can go over later. Donna, if you can separate the questions for me, the ones that I'm not getting will be great. So this is about the online Chinese medicine. So let's go back to the herbs. Let me see. Yes, Chan, perfect. This is what I do too. I use telemedicine provided by Unified Practice. This is exactly what I do. They have a safe platform, is really easy to use. They set up everything for you. You just need to make sure that when you put the options for consultation, you have the online, the telemedicine consultation. Yes, that could be one good option, Cheng. Thank you. So let's go back to the herbs now. As the title of the class says, this is a class for someone that wants to use herbs in their practice, or it's using the herbs, but it's not doing, let's say, a lot. This is exactly what happened with me. I will tell you guys my story a little bit. Like I said before, I knew that I want to do herbs, but when you are facing your patient and you need to prescribe a herb, is not an easy task because we don't feel confident enough. We think that we don't know enough. So I have here your best tools to learn and feel more comfortable prescribing the herbs. Thank you, Joel. The collection formulas from Evergreen. That was one of the best things that happened to me, because it's not that the classical formulas are not good. They are amazing. They are great. But there are a lot of things about the collection formulas that make our life much easier. And I will explain that. So after you learn about the collection formulas, does everybody here knows about the collection formulas? Those are not the classical TCM formulas. No, they are not. The collection formulas are, we call the modern formulas. You can find them on Evergreen. I will explain about them during the class. You will understand a little bit more about it. Okay, some of you guys know about it, other ones not. Okay, so let me explain to you so you know a little bit more. The Evergreen offer this line called collection formulas. And when you buy them, they come with what for me, I call the Bible that is called the Clinical Manual of Oriental Medicine. I will show you guys here. It's always next to me. Oh, it's blurry, but I will show you guys the electronic version. You can see that. So you have the hard copy, is always in my table next to me. And there is the digital version. I put there how you can access that. This is the website, and this is the username and the password. This is one of the best things that you can use to learn how to use the collection formulas. It's amazing, guys. You really need, let me see what you guys are saying here. Thanks for the link, Tina. Perfect. Yes, I will talk about that, Donna. Yes. Yes, I will, Rina, I will. Okay, let's go. Another thing that I would suggest you guys should do, because I am watching all the classes from eLotus that talk about the formulas. They have 10 practical or 20 practical expert approved formula strategy for all herbalists. Those classes are available on an eLotus. I am watching all them. This because we need to learn all the time. We never know enough. And what is interesting, people, the practitioner, the practitioner can use the same formula. Different practitioner can use the same formula in different way. This is so interesting. This is because this comes with experience. So it's really important you guys to learn from different practitioners. They will tell, sometimes I will learn, when I think that I know a lot about the collection formulas, I will learn something new on the classes. So use the classes. The classes are really, really interesting for you guys to learn more about the collection formulas and how to use them. And practice, practice, and practice. There is not another way to learn how to prescribe formulas. I know that's hard. I know that's scary, but you need to practice. Let's go over little details that can help you with that. Let me go to the chat here to see. Yes, Luisa, that's it. Watching the videos. Okay, so I wish them. Okay, so let's go. Let's talk a little bit more about the collection formulas. Why to use the collection formulas in your practice? Like I said before, it's easy to choose the best formula for your patient. Another thing that is really important, I have one here just to show you guys. I forgot that I have let's see. This one is called GI Care. See? The name of the formulas are so easy for the patient to make the connection with their symptoms. You will see they have back support, shoulder and neck pain, men's easy, so many calm ZZZ. There are so many formulas with the names that explain exactly what they do. So it's an immediate connection for the patient. Patient will understand, okay, I came here for a back pain and she did acupuncture and I'm leaving the clinic with a formula that says back support. So it's much easier for the patient to understand why I'm giving to them a formula. I love the classical formulas and I use them. Don't take me wrong. I have several of the classical formulas here. But what is good about the collection formulas is the instant connection with the name of the formula with the symptoms, the patient's symptom. So it's easy formula name. The next one, they have the version for capsules and granules. I can tell you guys here in my practice, probably 95% of my formulas are in capsules. I have some of them in granules. I think that you guys went through that before. Let's go from. Okay. We need to understand that for most of the patients, the taste of the tea, the herbal formula tea, is not something that they are willing to try. So I have most of them as a capsule here because they can just swallow the capsules. But I have patients that really like the tea, like me. I take formulas daily and I prefer the granules. I prefer the tea because I'm a tea drinker. I love tea. So I grew up drinking tea. So I don't care about the taste of the tea, but this is me. I cannot think that because I like all kinds of tea that my patients will like too. So from my experience here, I can tell you most of the patients will feel more comfortable taking home capsules. They will feel more comfortable. Okay, but there is something about the capsule. When we are doing capsule, that means that we will need to do a little, the amount of capsules will not be like the allopathic medicine, 1 capsule per day or 2 capsules per day, because what we have on capsules is just 0.5 gram of the herbal formula in each one of the capsules. So usually we will be doing 4 capsules 3 times a day. Is not for everybody. I prefer granules myself. Yes, Joel, I love the granules, but it's much easier for the patients to do the capsules. So we need to remember and we need to explain to the patient, because I can see in their face when I prescribe them the formula, the capsules, and I have on a label 4 capsules 3 times a day and a total of 12 per day. They will get that face. It's what? Why so much? Why I need so many capsules? So this is when we need to take the time and explain to them about how much comes in each capsule and why we need to do 12. I usually say for your age, height, and weight, this is the minimal dosage for the herbs to work. So all the time, I never had a problem when I explained to that. When I explain that, patient will understand, and they don't see that as a problem. It is a problem for those that can't swallow capsules. That is a problem. So when I have a patient that can, because it's not a tiny capsule, but we have always the granules to offer that. So we have options. We maybe patients, the fact that need 1 capsule twice a day for their individual. Yes. Like I said, the 4 capsule 3 times a day, Michael, is what we usually do, but it's not all the time like that. We can change, I will change that depending of the patient. And we will talk about that later, Michael. There are patients that I will start with 1 capsule twice a day, definitely, depending on the condition. Yes, they are not synthetic, champ. Yes, they are God made. I love that, Chin. I love that. It is God's medicine. Forget that allopathic paradigm. Yes, Luis, I agree. That's it. And we talked about already why it's so easy to use the collections formula is because of the clinical manual. And you guys will understand why. Let's go to the next one. Okay, let's talk a little bit now about how to use the clinical manual. Do I have a question here? There is one, I will go over that, Ethan, about the dosage. There is one part on the book, on the manual, that will explain exactly how to do the dosage. There is one dosage that is what we do most of the time, but not all the time. We will go over that. So to do this part, I want to do something different here. I want to share another screen. I'm reading Tina's comment here. The way to explain is that's not shocking, is this: you need to take 10 grams, exactly, Tina, 10 grams a day. That doesn't sound much. Exactly. This is what I tell them. It's 12 capsules per day and a total of only 6 grams of herb per day. That's fantastic. Usually when we use the weight in grams, the patient will understand. Thanks, Tina. Yes. Some patients will go crazy with the amount of capsules that we need to do. Let me share another screen here, guys. I want to show you. Okay, let's go over here. Let's move this from here. Let's go to this. You guys can see my screen that has the clinical manual of Oriental medicine? Yes, okay, perfect. So let's go over this. Took me a long time to learn, and until now, when I was preparing this class to you guys, I found even more information in this manual that I didn't know. This manual is amazing. Has so much information that can help you guys. So let's go over here really quick. I will go in detail later about it, but the manual has 4 different sessions. The symptom disease index, the herbal drug index, and the lab test index, and also the alphabetic order. This is the 4 more important parts of the book. So let's go back here. Where is share my screen? Why did things always disappear? Okay. Let's go to the slide. Bear with me, guys. It's my first time, so I'm learning how to use this. So the strategic dosage guidelines, symptoms disease index, lab test index, drug herb index, and formula index. So let's go through some of the monograph for each one of those, the parts, the herbs. This is what you will find in each one of the formulas. The ones that are highlighted in blue are the ones that I use to do a document that I will show you guys later. Okay, let me see what's going on here. How about the patients with weak stomach? We have a formula for that. I will tell you guys. Let me go back here. Let me go, sorry about this confusion. I will learn how to do this. Okay, let's go back to the manual. Why the manual is so easy to use? You can find the information that you need from so many different ways. Your patient can come to you with a symptom, okay? Most of the time, they will come with a symptom. So if you come here on a session that talk about the symptoms, if you click on any letter here, let's say that your patient is coming complaining about acid reflux. Here, there is acid reflux. So after you do your intake and you get all the information from, you will know which kind of symptoms your patient has. If your patient has acid reflux, that is, the symptoms is heartburn, belching, indigestion, gastric ulcers or full gastritis, ulcer or full breath, you will identify with stomach heat. And the formula to treat that is the GI care. This is exactly the one that I showed you guys, the GI care. If your patient has, the acid reflux is caused by stress, this is a liver qi stagnation, and you can add the formula calm. But if your patient that has acid reflux also comes with excess heat, constipation, sweating, thirst, possible fever, this is excess fire. And you can add to the GI care, the gardenia complex. And also if your patient has bleeding with the acid reflux, is excess heat. So you need to add the formula nodal ginseng 9. So here you have the options. What you need to do is first to collect very well the symptoms and what comes with, because that will give you a lot of information when you need to choose a formula. This is the way to do it for symptoms. Let's go over another symptom here. For example, allergy. Look how many formulas we have available for allergies, but how do we know which one is the best? From the symptoms. So you need to collect information about the symptoms and look for the one here that will be the best option. If the person has allergy with cough, it's a long qi reversal. So you need to do the resveratrol, CF means cough. So this is the best formula for this case. If this patient has allergy with dry lesions on the skin, is a wind toxin. So you go to Dermatrol Dry. So you can go over all the symptoms here and trying to find the one that is appropriate for you. Let me see questions here if I have anything. Okay, let's go. Let's continue here. Oh, there's one question. Okay. We answered that already. So let's go back to the other option that you can do. You can find your formula. Let's say that your patient just came from their doctor and they have a prescription of a drug. So if you have the name of the drug that they are taking, you can come here to the drug herb index. Let's go here on the letter A and pick one here. Let's say Allegra. Let's say that the patient, it doesn't matter if it is over-the-counter medicine or prescribed medicine. You will find all them in here. But let's say Allegra. So this person is taking Allegra, and here's the symptom again. Nasal congestion with yellow sticky chart. So this is the formula that you use. If this person has nasal congestion with white watery discharge, this is the formula. And if this person that is taking Allegra has allergic or hypersensitive skin problems such as rash, itch, and eczema, this is the formula. So you can use, let's see if we can find amoxicillin. This is an antibiotic. They use a lot, this one. Let me see. For so many different bacterial problems. So let's see if it is a bacterial infection. This is the formula that you use, herbal ABX. If it is for upper respiratory tract infection with fever, headache, and sore throat, this is the formula that can do the trick. And you can go over all of them here, and next to it, it will have the formula that is good for. So if you have the name of the medicine, the drug that they are taking, you can come to this list and find it by name and see which formula you can use. This is the second way that you can find the correct formula, the collection formula. The third way is through the lab test. So you can have a blood test, urine test, or stool test. Let's say that your patient came from the doctor with a blood test and they had a high cholesterol. That is pretty common, right? So here you have the cases that you can find. This is the range, and this is it can be low or can be high. And here they will say which kind it is, with increased risk of heart disease, with kidney disorders, with diabetes, with obesity, with hypertension. So you have here the name of the formula for each one of them. So, okay, your patient has high cholesterol, but it also has increased risk of heart disease. So you know that you will give to them the Colisma or the Colisma ES. Colisma ES is more for people that has fat liver, and you will add the circulation formula. So you have the main formula here on top, and here is the formulas that you can add depending on the condition that the patient has. Let's go to the urine test. Let's say that they have protein and their urine test, and it's due to a kidney disorder. So you know that you can use the formula kidney DTX, that means kidney detox. Let's go check for stool tests. I do also functional nutrition. So I do a lot of stool tests. So when I see parasite in their stool tests, this is not a collection formula. This is a classical formulas. Probably most of you guys know. This is one of the best formulas for parasite. But let's say that there is blood in their stools. So you need to figure out where the bleeding is coming. So you will do the formula for bleeding first. That is the notoginseng 9. And if it comes from gastric or duodenal bleeding, you add the GI care. If it's due to irritable bowel syndrome, the IBS, you add GI harmony. I use that formula a lot. And if it's due to inflammatory bowel disease, Crohn's disease, or colitis, you add the GI Care UC. Due to hemorrhoids, you add the GI Care HMR that is specifically for hemorrhoids. Let me go over the questions. If they can take at the same time, Nancy, yes, they can take the same time, but you need to adjust the dosage depending how acute and how severe it is. Let's go back here. Another way to find the formulas here on the manual is coming to the alphabetic order. Here, you guys will have a pretty good idea about all the formulas that we have here. They are in alphabetic order. I have most of them, but you don't need to have all that in the beginning. I will go over that with you guys. Here, for someone that asked me about the dosaging. Here has a lot of information about the dosaging and the table. See, this is all in the manual. This is by the weight. For those that treats kids or teenagers, this is the dosage. So you will find all the information about the dosaging here. Any questions so far about the manual, guys? I know that is a lot. There is another way that they list the formulas is by body system. I love this one. This helps a lot to find the right formula. They separate here the formulas by the organ system. For example, for musculoskeletal disorder, we have the arm support, back support, corydalin, flex. We have all kinds of flex depending where the pain comes from, if it is arthritis, if it's gout, if it is muscle, tendon, and ligaments, neuropathy, spasms and cramps, spurs, trauma, and sport injuries. Those are the herbals. This is analgesic. This formula I use a lot. Knee and ankle pain, neck and shoulder, the noto ginseng that is for bleeding, osteo8 that is for osteoporosis. For the next one is the cardiovascular. So we have here all the formulas for the cardiovascular disorders. The cholesterol, triglycerides, coronary, hypertension, bleeding again, and this one is for the respiratory disorders. This is a long list. They have so many options depending on which kind of respiratory problem do you have. Liver and gallbladder disorder, they have a formula for dissolved gallbladders or the liver detox. Gastrointestinal, you guys know I do functional nutrition, so I pretty much have all them here. Okay, let me see this question here. For how, okay. The urinary disorders, dermatological disorders, and endocrine disorders, stress. I use a lot those formulas for sleeping problems. They are amazing and they really help the patients. I have a funny story about Shisandra that I will tell you guys later. Infectious disease, immune energy disorders, formulas for women. This Blossom phase 1, 2, 3, and 4 is really, really good for those that are trying to get pregnant. Is for each formula is in a specific week of the cycle. This is really, really interesting. Formulas for men, for beauty, for detox, and specialty formulas. There is a food allergy Chinese herbal herbs also that talks a lot about some information about allergy. You can go over this. So let's go back to our PowerPoint presentation here. Do you guys have any questions about the monographs? This is a little bit about each one of them. Okay. Clinical, let's go now. Let's check one of the formulas so you guys will know what to find here. Okay. Let's go to that acid reflux. Let's go to GI care formula. This is what you guys will find on the book when you click on a specific formula. This is after you find your formula or the formula that you think that is important for you. You need to make sure that this is the formula. So this information is what will help you. First thing is the clinical application. So you can see here, what is that used for? So first thing, let's say that the person has the acid reflux. So this is here, the clinical application, heartburn and all this. So for the Western therapeutic action, here we'll explain in Western terms the effect of the formula. So the effect of the formula is much easier for the patient to understand what the formula is for if you show this to them. Anti-ulcer, anti-acid, antibiotic, analgesic, gastroprotective. So if the patient is there for you saying that they have acid reflux and they need help for that, and you send them home with a formula that has this specific Western therapeutic action, it will make sense to them. They will say, okay, this is exactly what I need, I will take it. There is also here the Chinese therapeutic action that will help us because we learn this, we know this very well. So we can use this to help the patient to understand about the formula and this to help us. Here is the dosage. Each one of the formula will come with a suggestion of the dosage. This one is pretty simple. Take 4 capsules 3 times a day with empty stomach, 1 or 2 hours before meals. For more maximum effect, advise the patient to lie down 10 minutes following taking the formula. This is exactly what I will do. I will follow the instructions from the book. Some of them will need to adjust the dosage, but most of them, the dosage will be there. So here you have the ingredients, the background explaining about the disease, the symptom, the formula explanation. Here will tell you about each one of the herbs that they use in this formula and how they work. Cautions and contraindication. This is really important. I never prescribe a formula to a patient without coming here and checking. Even if I know that formula very well, everybody's different. Every patient has something special. So I always come back here and read to make sure. For example, this one has an allergy warning because they have shanko, and this is wheat, gluten. And for people that have celiac, they can't take this one. So it's really, really important to read this all the time. Clinical notes. with some important information here. Pulse. I love this one. For those that are asking about the supplementary formula, this is your guide. They will tell you which formula to add depending which kind of symptoms the person have. For this person that it has acid reflux and also has irritable bowel syndrome, they will suggest using the GI Harmony. In this case, they said instead, but you can add gardenia, for example, for excess fire. So here, depending on the other symptoms the patient have, you can add these formulas. You also have the acupuncture points that you can use in a treatment. They have the tongue points that you can use in a treatment. They have also the points for auricular. For those that like auricular, they have here the points to use for this specific kind of problem. This is one of the parts that I like the most, the nutrition. I call nutritional guidelines. It tells you here what to eat and what not to eat when you are taking this formula. What I usually say to the patient is, listen, you came here looking for a more natural way to solve your health problem. You are doing acupuncture. You are doing herbal formulas. So what about adjusting your diet to have the most benefit from both, from the herbs and from the acupuncture? Because if you are just doing herbs and acupuncture and not adjusting your diet, probably you could be ingesting food that is creating more problems for you. So when I explain that to them and I give them this information about the nutritional guidelines, it will make sense to them and they will do it. When they follow your instructions about the nutritional guideline, the chance of the herbs working is much, much higher. So this is why I do so much herbs here, because they really see herbs working. The formulas will work better if you do the nutritional guidelines too. So for that, I will hand out this information to the patient. I will show you how later. Another thing that I always inform them, lifestyle instruction. Listen to this. Avoid consumption of alcohol completely. Stop smoking cigarette and avoid exposure of secondhand smoke whenever possible. If you have all those symptoms here, one of those, you decide to take a formula, but you are still drinking alcohol, probably you will not get the result that you are looking for. And the patient can just tell you, this doesn't work. And it can work if you add more protocol, more therapy. So this is why I add the nutritional guidelines and the lifestyle instruction. Another one that I am studying all the time and reading all the time is about the case studies. It's so much guidance for me, because this is cases that happened before, that from practitioner that used the formula before. Maybe it's not exactly your case, but it is some guidance. Is from people that use the formula. This is specific formula. If you look here, all the case studies here is for GI care. See, GI care, GI care. So they will tell you here how they treated this 54 female with problems with acid regurgitation. And there are so many case studies here with how they did, which kind of formulas, what they added, which kind of a dosage. This one, for example, they did the GI care and astringent complex. So this teaches you a lot. This is more technical information for those that like this. I sometimes go over that, but not all the time. So this is what you will find on each one of the formulas. Each formula that you click will have the same information. You can go over that. And if you still have questions about the formula that you want to use, this part probably will answer your questions. What I want to show you guys is this. This is the document, the form that I give to my patients when they leave with a formula. See, in this case is the GI care, and this is the symptom that I'm treating for this specific patient. So I highlight the symptom. I put here the Western therapeutic action because I want the patient to understand why they are taking this. And I put the nutritional guidelines. I just copy and paste. I put here the nutritional guidelines. And I will highlight the most important ones, but I will go over everything. I just don't, I hand out, I give them to bring home, but I will go over each one of them during the consultation to make sure that they will understand. Simple things like drinking a large amount of water often helps. So most of the patients will not drink enough water. Chew slowly and thoroughly your meals. This seems obvious, right? But sometimes we need to tell the patient that has GI problems that they need to do that. And here they will tell you which kind of foods to eat. They will suggest to increase some kind of foods. And they give examples. See, yam, radish, potatoes, carrots, melons, cucumbers. They have also informations of food to avoid. They say foods that you should increase the intake and foods that you should avoid. So here, why I highlight this, because more important than adding foods that can heal you is avoiding the foods that can make you sick. So I need them to understand that how important this is. Here is more information. It's just copy and paste, guys, just copy and paste. And the lifestyle instructions. I will have all them and go over them to explain to them what their lifestyle can help them. Changing their lifestyle can help them to heal. Because treating any kind of symptom or disease or illness is not only one aspect of the health. We need to combine a lot of aspects of the health. So they need to understand why they are sick. They are sick because their lifestyle was not healthy. The food that they were eating was not good for them. There are so many other aspects. The sleeping was not good. So it's important for them to understand that. So this is something that I will hand out to them. They will take home and read, and so they can keep remembering what they can do and what they cannot. So this is the blue ones are the ones that I put in my not the case studies. The case studies I didn't put on a form. This is just to remind you guys how important it is to go over the case studies. It can help you a lot. But this is what I don't do the cautions and the contraindication on the form too, but it's important for you guys to check that. Definitely. It's really, really important. Never prescribe a formula without checking this for each specific formula. Let me see if we have any questions. Okay, no questions. Let's keep going here. So here you can guys can read later is the clinical application, the Western therapeutic action, the cautions and contraindications, the nutrition, the lifestyle instructions, and the case studies. So let's go over this. It's pretty interesting. This is a little bit about my story, guys. I want you to guys to understand that first, I am not an expert in herbs. I am just learning like you guys. My first order was in January of last year. I graduated in August 2020. I started practicing on November of 2021. And my first order of the collection formulas was on January of last year. And look what I bought. Every time that I see this, I laugh because it's so interesting. I bought only 3 formulas, 4 bottles. And this is how everybody should start. Don't feel shame if you don't feel comfortable buying a lot of formulas, because this is not the best way to do it. You need to start really small and slow. Why those 3 specific formulas? I bought NeuroPlus, Thyrofort, and Osteoate. Those are not, you will see on the next slides, my bestseller formulas. They are not on a list. But those are the first formulas that I bought. Why? Because I bought the formulas to treat my patients at that moment. So what motivated me to start using the formulas was because I wanted to treat that specific symptom of the patient at that moment. I had patient with Parkinson. So this is why I ordered NeuroPlus. And this patient is until today with me, and he's still taking NeuroPlus. How many Parkinson patients you will get in your practice? Probably not a lot. And the last 2 years that I have been practicing, I got 2 patients with Parkinson, but they are long-term patients. Both are with me for more than a year. So NeuroPlus is a really good formula. So what I suggest to you guys, if you want to start using the formulas, is to buy for the actual patients that you are seeing now. So go over like 3-4 weeks behind, maybe not even that, 2 or 3 weeks behind, and check which kind of conditions you are treating. Make a list of the symptoms and see which conditions you want to treat, and go to the list of the formulas and see which ones could be a good one, a good fit for you, and try and buy them. Another thing that I did to start, for example, Osteoate was for me, was not for a patient. Because another way to feel more confident ordering the formulas is to use it on yourself. I'm sure that everybody has a condition to treat. So try for yourself. I was at the time, Osteoate was because of diagnosis of osteopenia that I had. So I want to start working on my bones. This is why I ordered Osteoate. But from the last year, I treat all kinds of symptoms that I had. And it's perfect because you can see the formulas working on yourself. So I would suggest for those that never ordered formulas before to start ordering for yourself and ordering for your actual patient's case. So you don't need to buy a lot. You buy 1 or 2 bottles only, and you prescribe to the patient that you have been seeing now. My biggest order, if you see there, was in April of the same year. I bought 25 formulas in 100 bottles because I made formulas is almost mandatory for all my patients that comes to me. Since the first moment that they come to see me, or the first time that I'm talking with them on the phone, I make them to understand that the only way that I will work is using formulas for the treatment. They come here knowing that I prescribe formulas. When they are during the initial consultation talking about their symptoms, I would tell them the benefits of the formulas. So it's all about teaching them from the beginning what you can do for them with formulas. And it works because they will start seeing you as the Oriental medicine physician that can prescribe formulas to them. For my stock today is 126 different collection formulas. And I have between 3 to 5 bottles of each one of them. You guys don't need to do that now, and please don't do it. Don't do a big order. You need to do a small order and start with just few formulas. And as you get comfortable, as you start teaching your patients that you can prescribe formulas to them, it will be natural for them to expect. My patients now expect me to prescribe a formula. When I don't, they will ask for, Sayuri, where is my formula? Because they tried, first they were open to try because I educate them. I told them why the formulas is necessary. So they know about it. They know, they try, they see, they feel that it works, because they get results. So they are looking for more formulas to keep going with the treatment. So it's natural for my patient. Okay, Sayuri, you never had a patient that don't want formulas? Yes, I had patients that don't want formulas at all. And I think that everybody here got that before. There are some kind of patients that they are not open to try any kind of herbal formula, any kind. They don't trust, or they have their beliefs or whatever. And I had patients that came to me and said, in the first consultation, when I start talking about the herbs, I'm not taking any herbs. I don't like herbs. I don't trust herbs. I don't know where they come from. Even if you explain everything that you need to explain, they don't want. That's okay. What are the other kinds of patients that do not take formulas? Patients with specific conditions. I have patients with specific conditions for the blood, for example. They are on a treatment for any kind of blood condition, and the doctor told them, don't take anything extra beside the medicine that I'm giving to you. Don't take in supplement. Don't take in herbal formula. So those are the kind of patients they would tell me, I'm sorry, I would like to try, but I am not allowed. I don't want to mix with my medicine. That's okay. That happens. There are patients, for example, I treat several patients with cancer. And some of the cancer patients, the doctor will tell them, you can't take any other thing, any other kind of supplementation or herbs. We respect that. But we have an amazing formula for patients that are going through chemo and radiotherapy. I treat some patients with those formulas, and I have patients that don't take the formulas. So yes, there are some kinds of patients that will not take herbal formula, but I can tell you 90% of my patients is taking formulas. For how long, Sayuri? Okay, that is another conversation. Everybody will leave here with a formula because I want them to try, I want them to experience, I want them to learn about formulas. So they will try, but all the patients will like the experience? No. So some of them will say, okay, it's hard for me to take 4 capsules 3 times a day. So we will try to adjust. And sometimes will not work. Or other ones will say, oh, it's hard for me to swallow the capsules. I tried, but didn't work. So I don't want to take anymore. Or some of them will come and said, okay, I had before a question about sensitive stomach. There is a really important question. Yes, for people that has for example, stomach heat or stomach chi deficiency, taking most of the formulas will be hard because it will be hard to digest and can create a lot of uncomfortable symptoms. So this is why I always start my treatments with treating the spleen and the stomach, treating the deficiency or whatever condition you have in a GI tract. Because we need to understand that for any of the formulas to work, the body needs to be prepared to digest the formula and to absorb the benefits and the nutrients of the formula. Formulas is God medicine, but they are herbs. So the body needs to learn and the body needs to know how to absorb, digest and absorb. If you have a problem in your GI tract, you have problems digesting food, you have problems digesting food on the stomach, you have problems absorbing the nutrients on the large intestine or in the small intestine, you have diarrhea, you have constipation, will be really hard for the patient to get the benefits from the formula if you don't treat that condition first. So for those that have sensitive stomach, we need to treat the stomach first with probably, depending on the situation, the formula GI tonic, GI care, GI care 2, GI harmony, depending on the case. So if you have a patient that comes with a condition and also have GI problems, I will treat first the stomach and make them to understand why this is important. If you explain all that to them, it will make sense, because it makes sense. For pain is different. For somebody that comes with pain, if the person says that has a really bad stomach, I will send them the formula for the back pain, back support, for example, with the GI tonic, just to make sure that we have some support when they are digesting that. But it's really important to start from the GI tract. Any questions so far from that? Let me check here. Okay. No questions so far. Okay, let's keep going. So a little bit about how to order the formulas in the beginning. My first month, that was January, it was so interesting because to do this presentation, I need to go over to my order history. And it was so interesting to see how I did before. January, I ordered 5 times, guys, 5 times. Because first, we don't feel confident buying different formulas because you don't know if you use or not. So the best part about this is you can do small orders. You have a free shipping for orders for $120. So if you put order of 3, 4, 5 formulas, small order, you will get for a free shipping, and you don't feel the pressure of buying a lot and spending a lot of money. And if you next week you get another patient with a different condition, you go there and order again. This is what I did for many, many months. I was ordering smaller and smaller orders, small orders all the time for the patients that I need, that I was seeing at the moment. Until you get to the point that you feel confident, you know your best sellers, you know the formulas that you use the most, and you start feeling comfortable making a volume, a big order, so you can get the volume discount. This is what you can get for volume discount: 10% off for 50 plus bottles of herbs, or 15 off for 100 plus bottle of herbs. So this comes with time. more you see patients, more you prescribe herbs, more you feel comfortable buying the herbs and prescribing to the patients. Let me see here. Okay, nothing for me here. So those are my best sellers. Another thing that is important, when you go to watch the other classes with the 10 or 20 practical formulas, remember, those are the best sellers for that specific practitioner. You will have your own list. How do you, because I get a lot of cancer patients here, but I don't think that everybody will get that. So I get a lot of GI tract patients, GI tract problems patients, because I do functional nutrition. So this is something that you will learn as you go. But this is just a suggestion. This is just a list that you can go to the book or to the electronic version of the book and check what they are for. We will do that really quick. So, for example, the circulation is not, there's no S here. Circulation Sanjal. I will not go over all of them, but I want to go over all the circulation Sanjal because this formula is amazing and I want you guys to learn a little bit about it. Let me go back to the book. Okay. Okay, let's go back to the book here. Let's go to the alphabetical order. Circulation Sanjal. Here there is. This is the first formula that we have in my bestseller there. When you think about circulation, you definitely will start thinking about cardiovascular and circulatory disorders. And yes, this is really good for circulation problems, but this is what I like the most about circulation Sanjal. Severe, chronic, or unusual conditions that do not respond to standard herbal treatments. Use circulation Sanjal as an adjunct formula to boost the overall therapeutic effect. So I'm using this formula for a lot of my patients. Yes, it's really good. It's for a lot of patients, but not for everybody. So to make sure that is for the patient that you are thinking, you need to go and check the Western therapeutic actions. Here there is a dosage that another example of a dosage that I can elaborate a little bit more about the dosage. It says here, take 3 to 4 capsules 3 times daily. This is the average dosage. For severe cases, dosage may be increased to 7 to 8 capsules 3 times daily to relieve pain. So it will tell you for severe case what you can prescribe. This formula should be taken for no more than a month continuously. This is another important thing that you need to remember. As an adjunct to another formula to invigorate blood, the recommended dosage is 1 to 2 capsules in addition to the regular dose of the base formula. So here, most of the time on this dosage information, you will have a little bit more what you do in severe case, what you do when you are just supplementing with that formula. It will give you a pretty good guidance. Again, the ingredients for the formula, the background, the cautions is the circulation sundial is one formula that is really good for a lot of patients, but you need to make sure that the tongue shows stagnation. If the tongue is deficient, this is not the formula for those patients. So you really need to be careful when you are thinking about the circulation sundial. This is what explains here about cautions and contraindications. This is how you can add other formulas to this one and all the other things. See, nutrition. Some of the nutritional guidelines will tell you about supplementation. This is pretty interesting. All my patients that are taking the circulation that has stagnation, circulatory problem, I will also prescribe the L-carnitine and the coenzyme CoQ10 and the molten enzyme if they have problems with digestion and they need more oxygen to the body tissue. So here you have also information about how to supplement with vitamins and minerals. And this is great, guys. This add on so much information to your practice. You can do so much more for your patients when you know all that. And again, the lifestyle instructions, the case studies. Here, see, this use circulation. This use flax and pea with circulation sundial. Neuropathy, flax and peas for neuropathy, and they will add circulation to help with the symptoms. This one will make a combination of cordyceps 3, resveratrol, and circulation sundial and neuroplus, just one bottle at a time. See, it will explain how to do this combination. Additional information and all that. So we went over all this. I just want to show you guys about circulation sundial. Let me see if you guys have any questions for me. Okay, Donna can help you with the costs. Okay, so let's go back to our PowerPoint. GI tonic, GI care is for GI tract. Those are the ones that I use the most. Lonicera, I use a lot for any kind of cold and flu because it's good for wind hit or wind cold. It covers both and helps a lot. Balance heat, I use a lot for menopausal women with a lot of hot flashes and night sweats. It's an amazing formula, but they need to follow the nutritional guidelines. I will never be tired of explaining this to my patients. Because in the beginning, when I was not educating the patient about this, I will not get the results that I'm getting now. The women will come back after taking the formula for 1 or 2 weeks, telling me, Sayuri, nothing changed. I still have the hot flashes, I still have the night sweats. And at that moment, I said, oh my God, there is something missing. There is something missing. And I started studying and doing research and checking on the book. And that was the answer. We need to make sure that they are following the nutritional guidelines and the lifestyle recommendation. That will help a lot. Another thing that is important about this specific formula, balance heat, is where the woman is now about the menopause. I get a really good results with those women that are just moving from menses to irregular menses to no menses to menopausal. is really easy to use and we get a lot of results. And if we start the treatment from the beginning, right at the moment that the menses start getting irregular. Why? Because the body doesn't have a lot of imbalances yet. So herbal formulas are natural medicine. They are not as strong as hormones. And one of the questions that I get all the time is, Sayuri, is this a hormonal replacement? Is this formula a hormonal replacement? No, this is not a hormonal replacement. This is a formula that has herbs in it that will help your body to go back to balance, will help your body and the organs responsible for adjusting during this transition from reproductive phase to non-reproductive phase with a little bit less symptoms. So it's not a hormonal replacement, it's just a formula that will bring your body back to balance. Why we get all the symptoms for menopause? Because the body, it has an imbalance. It has a indeficiency. So usually a liver and kidney indeficiency. So if we adjust that right when it's happening, it's much easier for the women to go through menopause with less symptoms. And this is exactly what happened. But if you try to treat a patient with this formula, with like balanced heat, a patient that was doing hormonal replacement for 5 years, and all of a sudden she decided, okay, I don't want to do any more of that. I want to go to the natural route, and I want to do herbs. They come to you and say, okay, I want to switch now to the natural medicine. We really need to do that slowly, because if they just stop the hormonal replacement and start taking balanced heat, I can tell you it will not work. They will come back saying, Sayuri, is not working. Why? The herbs are not strong enough to adjust the body from such a strong and severe change. So what I suggest the patient to do is they keep doing the hormonal replacement and ask to the doctor to start lowering the dosage of the hormones, and we'll start taking the formulas. And slowly we will be switching from the hormonal replacement to the formulas. The body will get used to the formulas. The body will learn how the formulas work. The body will start following the instruction of the herbs, because each herb has a specific function. So that comes with time. And adjusting the diet, adjusting the physical activity, because for menopausal women to get the balance back is really important to do exercise. So there's a combination of a lot of things. Herbs are amazing and they are part of your treatment, but you need to make the patient to understand that is a combination of a lot of things. Calms is easy. Shine DS are formulas that we use for anxiety, insomnia, depression, depending on the case. We have other formulas, but those are the two that I use the most. Resolve Lower, Minotrol, and Mens Easy are the ones that I usually use for the lower jaw problems, like if they have endometriosis, if they have polycystic ovarian cyst, or if they have any kind of uterine system or cyst. Minotrol and menses is really good to help to regulate the menses. This is for pain, back pain support is one of the, I use a lot. Who will never treat the lower back pain, right? Lower back pain and neck pain is the one that we treat the most. So this is a really good formula. They have back support AC, that is for acute, and CR, that is for chronic. I use the acute more than the chronic, because when they usually come to you is because they are in a lot of pain. So the acute will be stronger to to give them a relief right away. And after that, we can go for the chronic to solve the root of the problem. The same thing for the neck and shoulder. The neck and shoulder, they also have acute and chronic. So I use the same idea to use those. The herbal A and G is one of the best formula for pain. We can go over this one. Let me see. Oh, let me finish this first. The herbal A and G is for pain, and for the herbal ABX is for bacterial infection. So, like I said before, I have 126 formulas here today. Those are what I use the most. But therefore, for the ones for bacterial, for example, we have other options depending if it is a respiratory infection, if it is a GI problem, bacterial GI problem. So there are a lot of other options. This is just a general idea for you guys. This is why in the beginning I told you that you can go to the other classes, the 10 or 20 practical for that the practitioner will teach you specifically for each one of those formulas. My idea for this class was not to do that, because you guys have so many other options available on the eLotus. I just want to do something more practical, more how to help you to actually start using the formulas. So let's go a little bit more about how to introduce to the patient the idea about the herbs. How do we do traditionally? How we will prescribe traditionally the herbal formulas? We do the patient assessment, the pattern identification, the formula selection, the herbal formula modification, the dosage and administration. This is how we learn in school, right? This is how I learn in school, and I'm Christy, I am seeing your question here. Yes, we have a formula for Lyme disease. Let me see if I don't remember. I will find that for you. I have here. But yes, we have it. Let me go here. Practicing in the real world, creating connection. This is how we saw before, how the school would teach us how to prescribe formulas. But when we are facing face to face to the patient is a completely different situation. And what I learned from experience is the only way that you can prescribe a lot of formulas is to creating a connection with your patient. The patient really needs to be with you on the idea that formulas can actually help them. And how we get that? With patient education. This is why I create a lot of forms to hand out to the patients and explain them about the formulas. You have other materials that you can use. Let me see if I can show you. No, Chinese herbs medicine. This is one. If I knew that this background will not help, I would not put that. This is one brochure that I have here that I hand out to the patients. And also Evergreen has another brochure. It's called Why Evergreen Herbs. I don't know, maybe Donna can show that or give more information about that. I can't show because this is the one. I use this a lot. I give to my patient. It's a brochure with information about herbs. This also helps a lot. Another thing is listening. To create connection with the patient, we need to be willing to wait, to listen what they have to say. I don't mind. This is why my initial consultation is 1.5 hours, because I want them to be able to explain what's going on to me and to feel comfortable telling me what's going on. I don't know if you guys realize that in your practice, but most of the patients, most of the time, they want somebody that can listen to them. They have a story behind. Let me see, I see a lot of questions popping up here. Yes, Donna, yes, I know the brochures. Thank you. Thank you, Gianna. Yes, you got it. It's herbal ABX for Lyme disease. Thank you. So it's really, really important to create a connection with the patient. I would tell you guys that is the most important thing in my practice. This is why I feel so comfortable prescribing the herbs, because they trust what I'm saying, because I take time explaining to them and I take time listening to them. Empathy and compassion is another thing. Don't tell anybody, but I have a policy here. The cancer patients, they don't pay full price on the treatment here. They don't pay full price on the initial consultation, because I think that is my way to help them in such a hard time, because cancer is not an easy thing to go through. And I had patients here coming to me at the next day that they got the diagnosis of cancer. In this case was breast cancer. She came to me at the next day that she had the diagnosis, and she was devastated. It was such a, and she stayed with me during the entire time of the treatment. She did surgery. She removed both breasts. She did chemotherapy, several, I think, I don't remember exactly because it was last year, but she said she did several chemotherapy sessions. She did radiation. She did, I think, 30 radiation. She did the reconstruction of the breast. She did, I was with her during the entire process. And it was so nice to be able to help her this entire time. And I gave her a special prize, because this is my part about helping people. This is why I'm learning all that. Learning herbal medicine was so hard in school. I struggled so much. I remember telling to myself, like, I don't know if I can make that. I don't know if I can make it. It's so hard, but I will do it. I will do it. I will learn this thing about herbs. And now that I can do that I can practice, I think the minimum that I can do is first to share my knowledge. Second, to help people the most that I can. So compassion is really important. They understand that when you offer one bottle of a formula for free because they are struggling at that month to pay for the formulas, they will love that. They will stay with you. If you need to do, I have the cancer patient, she wants to buy the granules because it's a little cheaper, because the size of the granules is 100 grams. The size of the capsules is 50 grams. So you get more from the granules, but she hated the taste of the tea. So she said, I want to buy the cheaper one but I don't want to do the tea. I said, okay, I have a machine, a manual machine that can encapsulate the granules. So I will, you can have it and do, and you bring back later. And this is what she did. She bought 5 bottles of the CR support, that is the formula for the cancer patients, and I gave her the machine, and she encapsulated all the and she took the capsules during the treatment. So this is my way to find a way to help, to have empathy, to have a compassion, to help them. Let me see if we have more questions. Okay. Effective communication is all about what I'm talking about now. Patient education. We need to keep open communication with them. Every patient that leaves from the first consultation, I would tell them, I am not the kind of traditional doctor that don't talk with the patient after they leave. So feel comfortable sending text message to me if you have any questions about your herbs. Let me know how you feel 24 hours after you start taking the formulas. This is the follow-up and continued care. I make them to send me a feedback 48 hours after start taking the formulas. If they don't reach me, I will reach them and send a quick text message, let me know, give me a feedback, how are you feeling with the formulas? It's really important, and I will tell you guys why with a funny story. In the beginning, when you are learning how to use the formulas, you don't feel confident prescribing the dosage right away. And this is what happened to me. There is a formula called Schisandra ZZZ that is really good for insomnia. And I remember it was right in the beginning of last year, 2022, I got this patient with really bad insomnia. And I prescribed the dosage will tell in the book that you can give them 8 capsules 30 minutes before bed to help them with insomnia. But I was not comfortable with that dosage. So remember that idea to start slow and increase gradually to make that safer. This is what I was thinking. But I didn't know a lot about the formula. So I told her take 2 the first night and let me know next day how you feel. And we were texting back and forth. And the first night she took 2 and she said, no change. And I said, next night, take 3. And next morning she said, no change. And the following day I said, take 4. And next morning she said, no change. And we kept going up and until we got to 6 and she disappeared. Sure that she will disappear because it was not working for her, and probably because I was not feeling confident given the 8 capsules the first time. And she was now when I review her case and I review all the symptoms, now I know that she was the kind of patient that I could give to her the 8 capsule the first time and probably will get some response. But I didn't have any experience, so I understand. You guys need to understand that those mistakes can happen. Let me tell you, I did mistakes that happened in the beginning, but the only way to learn is to keep going. The only way to learn, for example, now what I can tell you, it's about Schisandra ZZZ. After all this, because it's one of my best sellers. It's not in the list, but I prescribe that a lot. now I had patients that with insomnia, with 2 capsules of Schisandra, were sleeping 6 hours straight in the first night with only 2 capsules. And I had patients with taken 8 capsules of Schisandra 30 minutes before bed that were able to sleep in the first night 3 hours straight. And as it goes, she will sleep in better and better until she gets to 8 hours straight with Schisandra ZZZ. So now I know that the dosage will depend on the severity of the symptoms. But this is something that you learn only when you practice. You really need to practice. Don't feel afraid to practice. Use all the tools that you have and wait. With time, you will feel more comfortable. This is exactly what happened to me. It's 2 hours. We started 2 hours. I think that we can do a break now. What do you think, Donna? Okay, let's do that, guys. Let's have 15 minutes break, a little bit more. It's 3:02 now. Let's go back to 3:20 so you guys can get some rest and I can drink some water. And I will see you guys at 3:20. Is that okay? Hello, everyone. Is everybody back?
Yes.
Perfect. So let's continue here. I saw the questions on the Q&A and I will answer later. We will have a lot of time for questions. I am almost done with the slides. So you guys take advantage and ask me all the questions that you want. I am here to help you the most that I can. So let's keep going here. So we are talking about the creating connections. So this is, I want to just make sure that we are not forgetting this. This is one of the most important things that we can do for the practice, creating connections with the patient. And one of the ways to do this is through the patient education. I will never get tired of that. This is why I keep repeating and repeating, because it's important. So use a clear and simple language. This is pretty interesting because if we try to explain to the patient in the Oriental medicine terms, most of them will keep looking at us and try and saying like, I'm not getting. So more simple words that we can use to explain how we are treating them, it's better. I am not really good with technical words, mostly in English, because the English is not my mother language. So I have the tendency of using really simple words to explain. And if I can't find the word, I would just try to explain better with more words, simple words. And this is what I do with all my patients. I don't feel shame of not using technical words. I think that clear words and simple words are much easier. This that I told, the provide comprehensive information, the nutritional guidelines and lifestyle recommendations is the form that I showed you guys earlier. Do you guys have any questions about that form? Do you want me to show again? Which form is that? I can show you guys again if it is something that you would like to, because it's not in a PowerPoint. So it's just a suggestion. It's something that you can create your own. I create mine. And the kind of information that I have on is the ones that I think that is the most important. Could it be added to the notes? Jennifer, I'm not sure, but I will show you again so you can take notes. Let me show you. No, go back. Here there is. Let's go here. Okay. This is the form that I'm talking about. So I have my logo in the top. This you can create with any kind of information that you think that's important. I put it, lately what I am doing also, I'm putting here on the first line, the name of the patient. That could be one idea for you guys too. So it will be more personalized. It's patient like to see their name on it. So I would put here on top of the name of the formula, patient name. And what I choose for this form is the clinical applications. And I will highlight the one that we are treating. So the patient can identify the symptom, the Western therapeutic action, the nutritional guidelines. And the bottom here, I have the information about my clinic. On the top, I have my logo. And nutritional guidelines, I will highlight the ones that I think that is more important. And the lifestyle instructions. Maybe you think that there are other information that are important to share with the patient, so you can create your own. So you create this while they are receiving the acupuncture. No, Jessica, what I do, I have, it's interesting how things happen during the practice. I create this form from because what I was doing before, I will open the book, because the books, the clinic, the manual will stay on top of my table all the time. So when I'm prescribing the formula, I will open the book and show the patient what is in the book. And they will get so interested that sometimes they say, can I take a picture? Can I? And something I pop up in my mind is to say, I know what I would do. I will create a form. So as I go, I will create the form for each one of the formulas. I didn't go and create a form for all the formulas that I have now. But as I go, I will create the form. While they are on the acupuncture on the needles, most of the time they will stay on the needles for 20, 30 minutes. I will just go to my computer and copy and paste. I have the form ready just to do the copy and paste, adjust, and print. After this, the GI care was done. It's on my files, so I don't need to create again. So if the next day I have another patient that will be using the Blossom one, so I will create that for that specific patient, and it will be there for me to use when I want. So I don't have the form for all the formulas right now, because I have been doing that for the last 6 months probably, but I have for most of them. And it's something really quick. You can create as your patient is on the acupuncture. Let me see if I answered. Yes, exactly, Jessica. I do while they are receiving the acupuncture, just the first time. After that, you will have it and you don't need. for a few days. Are you giving them the whole bottle, just the amount? Okay, Ayun, I hope that I'm saying your name right. I always give them the bottle with 100 capsules. If they are taking the regular dosage, 4 capsules 3 times a day, that will be good for 8 days. So I think that the minimum time that somebody needs to take the formulas to get some results is 8 days. And sometimes we need much more than that. So 1 bottle is not too much at all. And it, even for pain, if they have lower back pain, shoulder pain, or any kind of pain, usually I need to give a higher dosage. I will give like 6 capsules 3 times a day. Sometimes I do 8 capsules 3 times a day, depending on the severity of the pain. That will last only 3 days, 4 days. So I never had a situation that 1 bottle was too much. What I had before is a case of the patient that will get the bottle and they will start taking and they don't feel well and they want to bring the bottle back. I usually don't get the bottle, I don't receive the bottle back because it's open, nothing that I can do for that. And what I learned is from some kind of formulas. Let's talk about Schisandra again. Schisandra ZZZ is one formula that is not for all the patients, and the dosage will vary. What I do, I have an open bottle of Schisandra ZZZ from a patient that brought back, and I allowed her to brought back, and I received and gave her the credit. But this is not something that I do all the time. I kept that bottle here. And what I do for the patients that want to try, I will give just enough, the amount of capsules for them to take for 2 or 3 days. That is something that I do sometimes with some of the formulas. So this is one idea for you, that if you think that the person doesn't need the whole bottle, you can open and give just few capsules to them. I will not charge for that because it's just a trial. It's just for 2 days, maximum 3 days. And it's a way to make the patient to feel more comfortable, like I'm not spending the money for something that I don't know if it work. But I can tell you, I did that probably 3 times only. So it's not something that I do all the time. Patient suggestion in email by creating forms are good. Okay. Yes, for ERC, it's a recommendation. It's perfect. It's really good, Christy. It's a really, really good idea. See, this is what I love about those classes. We are all learning from each other. Every time I will come up with a different kind of form that I can create and give to the patient. There is one form from a website called Acupuncture Works. No, AcuLoads actually is from the same group, from AcuLoads. I sign up for that website, and they have forms ready for you to use that explain about each organ. For example, for lung qi deficiency, there are explanation of the symptoms, explanation of the herbs that you can take, and suggestion of exercise, qigong exercise that you can do for that condition. And you have acupressure points that you can do for that condition. It's beautiful, it's amazing. So I use that too. It's a really good resource for you. It's ready for you to use. You just sign up, get access to, they have a huge amount of forms ready ready to use that you can just print, put your logo and the name of your logo, and you can use. I use them too. Let me see, some points was not sure there is any side effects from herbal medicine. Do you offer samples for them? Yeah, this is what I explained. Yes, like I said, it's not all the time, but for some kind of some kind of patient, I think that is necessary and doesn't hurt the business at all and creates more connection. This is what I mean about connection. It's really important to have connection. Yeah, I love the idea of giving the information for them to read at home. I don't know if they will all read at home, but they have the information there, Jana. And it's not like you are leaving the clinic with just a bottle in your hands that you have no idea what's that for. You are leaving the clinic with a lot of information, with printed forms, so that creates connection. You know, this is what I mean about connection. Okay, we answered that. Acu lobes, oh, sorry, Acu downloads. Hold on. Hold on. It's Acu loads, if I'm not wrong. I will check and type for you later. Let me see here. Everybody's asking me the name of the website, so I think that I should check. Bear with me, guys. I will find the name of the. Okay. Here. Is this? No. Uh-oh. I will need to look later and let you guys know. I usually have this here ready to use. Okay. I will give you the name later. Okay, guys. Okay. Johan, I will answer your questions, okay? Michael, I will answer yours too. Let me just finish here. We are almost done with the slides, so we can answer a lot of questions. Let me find the name of the website. We need to give you guys later. It's pretty interesting. Okay. It's acupuncturemediaworks.com. acupuncturemediaworks.com. If you go to that website, you have access to AcuLoad. That is the Acu downloads. Let me type this. Oh, I found it. Rina, can you put the Acu downloads also? It's the same company, but I think that will be straight to them. Their forms are amazing. They have a lot of good material there. Yay. Sorry. Welcome. Yes. Thank you, Rina. What I would do without you. Oh gosh. Okay. So there you can find, it's a annual membership, something like that. It's not expensive at all. And you have access to all Oriental medicine information that you can, it's forms, they have for intake forms that you can use. They have those forms about the organ systems with the information of each one of them. They are all the time creating new forms. They have packets ready to use for social media. So have fun there, guys. You will see a lot of really interesting things to use there, mostly for those that don't have time to be creating anything, because I don't know about you guys, but here in my clinic, Seed of Health is one-person clinic. I do everything here. I have one person that helps me with the social media, but everything else it's me. So it's really good to have some help, and this is a good one. So let's talk a little bit about the follow-up. We learn in school that a follow-up is really important, but actually before I finished my master degree, I was working for so many different practitioners. I love that time because I knew that I want to have my own clinic. What happened is when I graduated, I knew right away that I want to have my own clinic. I don't want to work for anybody. Not that it's bad, but because I did that for so many times before. I had other companies before, so I knew how to create my own business. So I said, no, I will have my own clinic. And this is what I did from the beginning. I started with my own clinic, but I was working inside another clinic. I rent a little room inside another acupuncture clinic, but I was completely independent. So during the time that I was at school, I was working for so many different practitioners because I want to learn how they do business and how they treat the patients, which kind of resource they have. And one thing that I learned is most of them, or all of them, they don't do follow-ups just because it's too much work. And I know that is work. But the follow-up, mostly for those that are doing formulas, herbal formula, is really, really, really important, because you need to know what's going on with the patient when they start taking the formulas. Formulas are great, but different people have different reactions to the formulas. Some of them can have some kind of sensitivity to one herb and can hurt the stomach. Other one will keep them up at night. So how do I know all that now? How do I know how to use the formulas? Because I was getting the feedback from the patients all the time. So now I know, for example, if I give to the patients formulas that invigorate the blood, any kind of formulas for pain that has any kind of herb that invigorate the blood, they increase the circulation of blood in the body, they cannot take after dinner, for example. So now I know when I'm prescribing that kind of formula, I would tell them, you can take half an hour before the meal or 1 hour after the meal, but on the dinner, you will take before dinner. But how do I learn that? Okay, we have there on the book saying that invigorates the blood, but most of the time what will teach us the most is the experience, the actual thing happening. And when I start listening from my patients, Sayuri, do you think that this formula can keep me up? I took the formula last night and I couldn't sleep. And I started making connection and thinking it's invigorate the blood. It will keep them up. And I will ask the next question to the patient now is, what time did you take the formula? Oh, I had dinner at 8 p.m. and I took the formula at 9 p.m. and I went to the bed at 10 p.m., 11 p.m. Sure, that person will not sleep well. So this is something that I learned from the feedback, from the follow-up, mostly for those that don't have experience, most for those that are just like me, starting using the formulas. Listening from the patients is one of the best ways to learn. So follow-up is really, really important. I will schedule a follow-up appointment anyways after the first consultation because I want the patient to come again. So what I use as a motivation for that is to say, look, you are just going home after acupuncture, you are feeling better, you don't feel a lot of pain like before. You are taking a formula that will help you with the pain, but I need to make sure that this is the right formula for you after 1 week. So I would suggest you to have a follow-up consultation with me in 1 week for us to go over your symptoms again and go over how the formula working in your body for 1 week. So I will know if I will continue with the same formula, if I need to adjust the dosage, if I need to change for another formula. So all my patients, they automatically say, okay, let's schedule another follow-up appointment for 1 week. This is when I get a lot of information also about the formulas. So one thing I think that we can separate in those, now that I'm looking at the PowerPoint here, I think that one thing is the feedback about the formula in 48 hours. And another thing is the follow-up consultation that the patient will let you know how the formula worked for 1 week. This is all treasure. This is all gold. Any information that the patient can give to you, it's important. Follow up, assess the treatment progress. Sure, we need to know how the formula is working. Adjust the herbal dosage of the formula. I usually don't wait for the follow-up anymore. Before, I will wait for 1 week to adjust the dosage of the formula, but what I learned is those patients that for any reason, they are not taking the formula properly, or the formula is not working properly, they will kind of give up on the formula after a few days. So what I tell them now is give me a feedback after 24 hours, 48 hours, so I can adjust the dosage or adjust the time that you are taking the formula. There are so many things that can make a difference on an effectiveness of the formula. The dosage, the time. For example, most of the formulas, they will say take half an hour before the meal or 1 hour after. But some of them, because of the stomach problem, remember somebody asked me about the digest problems, they can't take the formulas with empty stomach. So if I know that in the first or second day, I would just tell them, okay, if you are feeling some stomach pain, try the formula with the meal. Don't take before or after, take with the meal and let me know how you feel. So this is the opportunity for you to adjust whatever it needs before the patient actually give up on the formula, because I don't want them to think that doesn't work. And it's possible. It's really important to know exactly what's going on. After a while, the patient get used to know exactly what to do, and they will just send to you the information. They will give you the information, and you don't need to ask, because you educate the patient to give you a feedback. I know that is a lot of work, but it's so worth it. It's so good. It's so much information, and takes sometimes just few minutes for us to get the feedback from the patient. Monitor for side effects or adverse reactions. This is what I mean. We need to know what's going on. We need to know if it's working or not, so we have the chance to fix the problem. Reinforce compliance and lifestyle recommendation. Again, if they say, oh, I am having this and this reaction, and you say, okay, are you following my instructions? Are you avoiding this? So it's another opportunity to educate and tell them what they need to do. See, educate and empower. That's it. This is exactly what we are doing here. Document and track progress. This is another thing that I learned from experience. I use unified practice, so they are great for the soap. So you have all you have everything that you need there, but you need to feed with the information. And in the beginning, I will get the feedback from the patient, but I will not take the notes, and I will get lost. In the next appointment, I don't remember exactly what the patient said on a feedback. So this is really important. You need to take notes about any kind of reaction that a patient has with the formula. So it'll be there. For if in 4 weeks, the patient comes with something else, you go back and see, oh, but remember in the beginning, we are just with this and this and this and it was working. So it's much easier for you to talk with the patient when you have the information there for you. So really, really make the notes. The notes are really important. Let me see. I see comments here. I feel like that is how I have retained clients since. Perfect. Love it, Shayla. It's exactly. My clients love the follow-ups. Perfect. Exactly like that. Lee, and show you truly care about your patient. Exactly. This is what we need. We want connection. This is why this is all about connection. Sayuri, I believe you said usually follow up the next day via text message. Okay. Yes, there is the feedback from the patient 24 hours, 48 hours after. And that is the follow-up consultation, Jennifer. That is two different things that I do both. I check 24, 48 hours. If it's no weekend, I will give a break to the patient and to myself and ask on a Monday. So it will be 48 hours. If it's weekdays, I will do in 24 hours. Just a quick text message. How do you get someone who will not communicate? Yeah, I know, Helen. Doesn't happen with everybody. It's not every patient that will communicate and let you know. I had patients that I will send a text message that they never answered, and they will come for the follow-up consultation and they will be happy with the herbs. So I will presume that no message is a good thing. I would say that if you don't get any complaint, and because most of the time it's like that, if they don't like, if there is something going wrong, they will find a way. Most of the time they will find a way to let you know. Some of them will not. This is why I do. So definitely I know that there are some of them that will not give you feedback. So you just wait for the follow-up consultation. In case of the side effect, what you do, okay. Depend on the side effect. As you go and as you use more the herbs, you will learn that some of the formulas can give some side effect. I will not say side effects, but I will say everybody's different. This is why it's so important to adjust the spleen and stomach first, because one of the most common problems that I have with herbs is that they can't take because the stomach has too many problems. So depending on the problem, there is different thing that I can do. First, depending on the side effect, I can reduce the dosage. I can change the time of they are taking the formula. And I can suggest another formula depending on the side effect. So depends on what's going on. But before, one thing that is really important, when they come to you with side effects or any kind of complaint, ask questions. Do not only accept what they are saying, because usually it won't come from the formula. I had a patient before that, for example, this week, I'm treating a lot of GI problems with her. And she told me that one thing that happens sometimes is she will get the whole capsule, the entire capsule in her stools, like it's not digesting at all. And she told me that before she started the treatment with me. This is one of the reasons that she said, I'm afraid of taking capsules. She's in treatment with me for 6 weeks already. And she didn't have any complaints about the capsule showing up in her stool. So for me, she was not having that problem with the formulas. And this week, all of a sudden, she came to me and said, look, Sayuri, I got the capsules on my stools. And the first thing that she said, do you think that comes from the formula? And my mind started thinking, okay, she has been using the same capsules the same for a while. She never got that. Is there something else? So my first question to her was, anything happened this last couple of days that changed your emotion and that could impair your digestion? No, I was okay, nothing happened. Did you change any kind of other supplements or medicine that you were taking before? Oh, that's true. My doctor just changed my medicine for whatever, and now I'm taking another one. And I said, did you had problem with this kind of medication from this doctor before? And she said, yes, that was the capsules that was showing up in my stools. So it was easy for me on a conversation to get the conclusion that actually the problem was not coming from the capsules from our formulas. It was coming from the other supplement that she was taking. And this can happen with anything. So it's important to ask questions when they come with any kind of complaint or side effect. Start asking questions to make sure that the problem could be coming from the formula, because it could not be the formula. I had so many times that a patient will come to me and say, oh, I have a problem with the formula. And when we dig deeper, we will figure out that it was not the formula, it was something else that she was doing. Nausea. When the symptoms gone, what do you do for the patient, and how do you ask the patient to continue the herbs, stop suddenly or gradually? Great question. Usually, patient never comes with only one symptom. It comes with 3, 4, 5 symptoms. So I will start treating the pain first, because I don't want anybody in pain. This is not comfortable, it's not good. And patients usually come to you to eliminate the pain. So the first thing that I would treat is the pain. And usually when we treat just the pain, there is the root of the problem. So when you get rid of the pain, you need to figure out what's going on. And most of the time, the problem comes from other systems. So usually I will have other treatments to do. For example, I get a woman that comes with the hot flashes. And so we will treat that and the hot flashes will get better, but she will tell me that she's getting a lot of bloating too and a lot of problems with constipation. So we will go for the constipation. So I will treat one thing at a time. I have a patient that I start treating neck and shoulder pain. That it was so interesting. I started her with neck and shoulder pain. And as we go with the consultation, she tells me that she has cyst ovarian. So we started using the Resolve lower for the cyst ovarian. And after that, she came to me and said, you know what, I forgot to tell you that I have psoriasis. So now we are treating the cyst and the psoriasis at the same time. So it's always like that. The patient that choose natural medicine will keep coming to you for other symptoms or just for maintenance. This is what I see. The patients that are with me for almost 2 years, for example, that we don't have the symptom anymore, the condition anymore, they come just to make sure that the body is in balance and they will not get another problem. And they feel that acupuncture helps so much. And the formulas that can help with maintain just the balance. Sometimes if you see the tongue a little pale, you ask about nutrition and you see that they're not eating well at that time. So you will include a little bit of formulas to but tonify the blood and tonify the chi and give some instructions about food. So it's a work in progress. What happens sometimes, I don't stop suddenly or gradually. As they get better, I would just switch to the next condition, and as this condition get better, they just stop taking the formulas for a condition and start taking the formulas for maintenance. You don't need to stop gradually. Let me see. I follow-ups written in my contract that they need to respond. That's a good idea, Shayla. Yes, that is another way to do it. There are so many ways to do follow-up. This week, I saw something, what I think it was on Acupuncture journal, something, magazine. Somebody talking, saying that the one good way to do follow-ups is with surveys. I never thought about surveys. That could be another one. But when I had other business, I didn't get a lot of response from surveys. I don't know. Sometimes you need to try. You need to try in your area. You need to try different things to see what will work better for you. Maintenance. Let me tell you my story. Nazi. Before doing the Oriental Medicine master degree, I was a patient for acupuncture. I went to look for a acupuncturist because I got frozen shoulder in some point in my life. And she helped me so much with the frozen shoulder. And after that, at that time I was working with a really physical work. I need to carry a lot of stuff. I would need to do a lot of physical things, demanding things. So I was always looking for something to release the muscles and help my body. So I asked her, do you think if I come every week, it will avoid me getting so much tightness on the muscles or tension from the anxiety or the stress from my work? And she said, yes. So this is what I call maintenance, is when you don't have any symptom that it's painful, any thing that is bothering you a lot, but you want to avoid that happening again. Because I usually tell my patient, is getting rid of pain is really easy with acupuncture and herbs. Avoiding them to happen again is another story. If you want to avoid that to happen, you need to come for maintenance. You need to come for acupuncture that can keep a maintenance, your body in balance all the time. So they will come, and I have patients coming for almost 2 years to make sure that they don't. And you know, life is not flat. It's impossible to keep the body balanced all the time. There are some weeks that you have more stress, other weeks that you have more work, other weeks that you need a little bit more concentration, you need to use more your brain. This is life. I don't think that we can keep life in balance 100% all the time. And this is why Oriental medicine is so important, because it can help you to balance that out. I hope that I answer everything here. Okay. So this is what I want to leave for you guys. For me is the most important thing that I learned from my experience. After this, I will go over to the questions. I know that it's tough. I know that it's a lot. I know that we always struggle. I know that we all need to learn, but be confident, be wise, and always trust your instinct. We, as Oriental medicine practitioners, we work with energy. We know that the body is energy. We know that we can feel energy. We trust energy. We know that energy can make us sick or we can heal us. So trust your instinct. That is the energy inside of you. I can tell you guys that 50%, the way that I practice now, 50% is knowledge, 50% is instinct. I try to connect so well with the patient. I need to understand so well what's going on with them, to connect with them, that I kind of know what they need. This is what I call instinct. Sure, you need information. I will not be able to do all that if I don't put a lot of hours in studying, if I don't use the manual, if I don't go to the classes, if I don't read books. And this is one part that I can do. And it's no way to learn without that. But at the same time, trust your instinct. And another important thing is not only how much you know, it's about how much you care about your patient. This is why I said that connection is so important. Do you have 100% of results? No. Do you have 50% of the results all the time? No, we never. It's hard for us to have a percentage of success all the time, the same percentage of success all the time, because we are dealing with human beings. And human beings are different, people are different. So, but when you connect to them and you listen to them and you trust your instinct, there are so much that you can get from that, so much that you can do. And this is how I have been practicing. This is how I have been using so much herbs in my practice, because I trust them and I trust my instinct that I can find the best option for them. Do I get that right all the time? No. I need to change formulas. I need to adjust. There are patients that will not stay here for more than 3-4 weeks. They will go away after that. I have patients that comes for one consultation and never more comes. There are other ones that will come for 4 weeks, other ones that will come for 8, 12, 16 weeks. So I'm not worried about that. I'm not worried about that. I'm worried just to do my best every time that I have a new patient. This is what matters to me. And they know, they feel that. Let me go over some of the questions here. Elhan, I loved all your questions, because this is something that I should explain on my PowerPoint. So we will do now. How do you do a financial part for, how do you do the financial part of your business and the herbal medicine cost? Okay. Like I told you guys before, I use unified practice. Unified practice control everything to me. It controls my stock, meaning I know exactly what I have in stock, because every time that I get a new order, I get the invoice, I will go in the system and feed the system with the information. So if I get 10 bottles of circulation Sanjal, I will go to my system, go to inventory and add the 10 bottles and the cost of those 10 bottles. So the software will manage that for me. So if I need, for at the end of the year, for example, that we need to send information to our accountants about our inventory, this is what I use. I will go to the unified practice and get my stock. So I think that when you say financial part, let me see, if I understood right, just to give you an idea. From my income, what I get, what I receive in my clinic, the income that I receive in my clinic, 70% comes from consultation, 30% comes from herbs or supplements, because I do a lot of supplements too. Before, when I was doing only herbs, was 30% too. So I would say that 70% of my income comes from the consultation and 30% from herbs. That is a lot. That is a add-on really good to your practice. How do you use a case fee? What do you mean that, Ahan? case fee do you charge for acupuncture and herbs in a pack? Okay, got it. Now I got it, your question. The initial consultation includes acupuncture and the herbal, the prescription of herbs. So I have only one fee for initial consultation. The patient will come and we will do the consultation that includes the diagnosis and the prescription of the herbs. Doesn't include the herbs itself. Why? I will tell the patient that it's hard for me to figure out the cost of the herbs because it depends on the condition and which herb I will use. But I will tell them the price range for the formulas will go from $25 to $45 usually. So they have and they last between 8 and 10 days. So the patient will have a pretty good idea about how much they will be spending with herbs if they come to me. This is something that I usually explain if I get the chance before they come for the consultation on a call or whatever, or on a text message if they send and asking questions about that. So I have only one fee, the initial consultation, that is includes acupuncture treatment and the prescription of the herbs. How do you make herbs and acupunctures and your supplements affordable? For me, more important than being affordable is to having herbs and supplements of good quality. When you start, you will have so many options. I remember when I was in school or when I used to go to the acupuncture conventions, you go to that huge space with so many vendors, with so many brands. I'm not saying that the other brands are not good, but I got the chance to try few of them and I choose the ones that I trust the most. So I know that the cost of herbs are something really important, but for me, I will explain to the patient that more important, because it's funny, when I started my clinic, my first order, not evergreen orders, because you guys saw in my PowerPoint that my first order on evergreen was in January 2022. But in November of 2021, I got order from other vendors, of other suppliers. And I got those TPOs because at school I was using the TPOs. Most of the formulas that we use at school was the TPOs. So I got used to work with TPOs. And I know a lot of practitioners that they use the TPOs. And I bought a lot of them. And I still have some of them here. Because I got used to do that, and it was what I learned. So it was natural for me to order that. But when I started going to the conventions and seeing that there are other options, and I started trying on myself, Donna, my internet connection is saying that it's stable. Are you having any problems with? I'm sorry about that. I had no idea. Guys, let me know when the $414. So what was the last thing that you guys heard from me? Okay. Okay. Perfect. Yep. But now I need to find the It's not showing my chat. It's not showing the Q&A. Sam, can you help me with that?
I think it reset, so you might not gonna see anything up right now. Can you see the new text, new chat?
We're done. No. Let me, probably when we went back, something is missing here. Okay. I found the questions, but I can't see the chat. I
Okay,
can
are
see.
you able to see the Zoom? Are you able to share your screen again?
Okay.
Let's try share Zoom screen again.
Can you see it?
No, you're not sharing your screen right now. We only see your videos and audio.
I think that I got a problem with Zoom because I don't see the button, the button to share screen anymore.
Okay, are you in the Zoom applications? Where are you right now?
I am on my PowerPoint.
No, you can close the PowerPoint off. I think the Zoom app probably behind the your PowerPoint. That probably you don't see it.
Okay, let me see. Got it. Yeah.
Okay.
Got it, got it. Okay, it was hiding, yes. So let me share my screen again. Screen. Hold on. Okay. Share screen here. Share.
Yep.
Yeah, we are back. Okay. So, perfect. Let me go back to the questions. We were talking about the quality, the affordable acupuncture and supplements. So the most important thing for me is to find a company that I could trust. And I know that I use the top formulas that I can have. I choose, this is what was my option to use the best formulas and the best supplements. So how I present this to my patients. I tell them, because some of them will say that is too much for me, I can't afford that, and I totally understand. But some of them will ask why this price, and this is when we need to explain about safe, about quality, about efficacy, about, because this is all about is an investment. Most of my practice is 98% cash based. I do just a little bit of insurance. So the patient is investing a lot of money to get treated here. They pay for the consultation, they pay for the acupuncture, and they pay for the formula. So I would tell them, you are investing a lot of time, money, and dedication to heal your body. So let's use the best tools that you have. Those formulas are really good, and they work if you follow my instructions. So this is most of the time is enough for the patient to convincing themselves that it's worth getting a better quality herb. I'm really not worried about affordable. I am worried about something that really works, because there are a lot of things that doesn't work. And it's so hard to convince the patient to use formulas. So after you convince the patient, if you take the risk of not giving them a formula that will do the trick, it's one lost opportunity. So for me, the most important thing is actually the quality of the formulas and everything else that we talked about before. Making sure that the patient is understanding what the formula is for, making sure that the patient understand that there are more into healing than only taking formulas. Elhan, did I answer your questions? Do you have any other questions for me? I hope that I answer all your questions. My favorite herbal formula, Lee, that is a tough one. Depending on the condition that I'm treating, but I can tell you that nowadays, one of my biggest complaints here, most of the patient, a lot of patients are coming with anxiety, depression, and stress related symptoms. And I feel that that is the root of most of the problems, most of the illness that is happening now. So there is one formula that is called Shine DS. I love that formula because that formula can help to stabilize emotionally the patients that are going through a lot of things. So for patients that has a lot of emotional instability, a lot of emotional related symptoms, the Shine DS is really, really good. I love that. Another thing that I like the most, I talked about the circulation to you guys, but as I go, I'm learning a lot about how to combine formulas. And there is one combination that surprised me to help women with menses problem. Is Schisandra ZZZ and Menatrol. I am treating a few young ladies, teenagers in their 15 all the way to 19 with a lot of menses problems. Most of them irregular menses or amenorrhea sometimes. The menses will not show up for a couple of months. And it's incredible, but it's mostly related to the emotional. Our teenagers now, they get a lot of stress. And this is changing their body. And I have one patient that I was struggling for a while to keep her menses regulate. In the beginning was coming, I mean, really long period, really long, like 40 days, 45 days, 50 days between periods, between menses. It was, took me a while to understand what's going on. And finally, the combination of herbs that was able to help her was Schisandra ZZZ with Menatrol. That is something that now is one of my favorite, depending on the condition, the problem with the menses. I will use that a lot. Shine DS, okay. Let me see what we have here. The TPOs, yeah, Shayla, we talked about the TPOs. Let me see, Shine DS, yeah, Shayla. Can you write this? Rina did that, right? Shine, exactly how you wrote there. Shine DS. Do you let your patient take herbal medicine along with other vitamins or natural medicine from other sources? Okay, great questions. Yes, but I will try through education to convince them to come to start using the vitamins and supplements that I have here. Why? The supplements and vitamins, minerals that I have here are from a really good source, from good suppliers, just like for my herbs. So I will explain to them what is a good supplement, how it's supposed to work, which kind of ingredients it's supposed to have in, what extra ingredients was not supposed to have in the supplements. So I will educate them about the supplements and tell them, you know, I know that you are taking the vitamins now. I don't want you to waste any money. You can keep taking that, but when you are ready to buy again, that's this one finished, you let me know, and I will suggest one from here. And I will show you what I have, and you can make your decision if you want to keep taking the one that you had before, or if you want to switch for the ones that I have here. One more time is explaining to them why some supplements will be better than the other ones. It's all about qualities and results. So when I do that, most of the time they will do exactly what I'm saying. They will keep taking the one that they are taking, unless it's something that is not good for them. I will give you an example. Nowadays, you can find everywhere on the social media. Take turmeric, curcumin, turmeric, all kinds of capsules, supplementations with all kinds of dosage. Everybody's saying, try turmeric. Oh, ginger is really good for it, whatever. And people are taking like turmeric and ginger like crazy. And when I see a patient the first time and I see on a list of the supplements that they are taking ginger shots in the morning with turmeric, ginger, or whatever. And I just look at their tongue and I see that they have stomach heat or any kind of excess heat on the body, or menopausal women that has the imbalance deficiency, yin deficiency. So I will tell them this supplement specifically, or this shot or whatever, it's not good for you now at this moment because you have excess heat in your body, and this kind of herb is hot in nature and will create more heat. So you need for now to stop this kind of supplementation. And if after I work on your body and we bring the balance back and you are feeling better and you don't have all the symptoms, if you want to go back to this kind of supplementation, slowly and in low dosage is okay. But if you start feeling again the hot flashes or the hot sensations on the body, or any kind of skin condition that is red or whatever, you know that was the single herb that you were taking that is hot in nature, that is aggravating your condition. So the only time that I would tell them don't use is when I see something that is not good for them at that moment. Let me see. Okay. Do you guys have any more questions for me? I think that I had on only, I put the chat now for everyone. I don't know if it was there before, just to make sure that everyone has access to the chat and can ask any questions. What do I charge for a new patient? Okay, I am in Florida, South Florida. Pricing, it's really important when you are setting up your pricing. You really need to do your homework and check around you how much people are charging. Okay, so what I would tell you now is how much I charge in South Florida based on what I have around me, because when I was doing my research to figure out how much I would charge, this is what I did. For initial consultation that will go between 1.5 hours and 2 hours, I charge $180. And for the follow-up, I charge $90. I started on November 2021 with $120 initial consultation and $80 for the acupuncture, and I started increasing a little bit. as I get more specialized and more information and more things to give to the patient, I start increasing my price a little bit. Now it's 180 and 90. Do you recommend vitamins along with herbs? Yes, Lee, I do all the time. But remember what I said before is more important than recommending vitamins is to make sure that your GI tract is working properly. We really need to, because what I see a lot here with my functional nutrition patient is they come from a long time trying to heal their condition, their stomach condition, with supplements. They keep adding more and more and more. There are some of my patients that come here taking like 15 to 18 capsules per day of supplementation, vitamins. But when I go check how their stomach and intestine are working, we know that the stomach is not processing the food properly, and the intestine are not absorbing the nutrient, meaning that you will have the most expensive poop ever because it will go over to the poop and the pee because you are not absorbing. So yes, I recommend vitamins along with herbs after I fix all the problems with the GI tract. This is something really, really important. Another thing that I want to tell you guys, I think that I missed that PowerPoint here. No, this is my information. There's this one. Let me be specific. This is another lesson that I learned in a hard way. Instruction on how to take formulas. Be specific all the time. What is obvious to you might not be to the others, mostly when we are talking about herbs. Let me explain you this. For us, it's so natural that taking capsule we need to swallow and take granules we need to mix with hot water and make a tea, right? We know that the tea works very well, and this is how we make tea, how we make the decoction. So I usually tell my patients when they choose to do granules, you take 2 spoons or 1 spoon, whatever those are that I prescribe them, put in on a mug, add hot water, mix until dissolve, and take as a tea. And work it very well. I thought that was working very well until one of my patients came to me. That was so funny that I couldn't believe. This is what made me think that we really need to be specific. We were talking, it's a patient that has been taking the formulas for a long time, and he never complained about the formula. It's everything okay. And one day he said, "Oh, I like to take the tea cold." And I said, "What? What do you mean?" "Oh, I just learned that the powder dissolves better if I put a room temperature water first, and it will dissolve quickly. So I decided to take the tea cold or on a room temperature." And I said, no. The tea is to be taken with hot water. Is it hot tea? So I never said hot tea. I said a tea. You can take it as a tea. In the beginning, I said, put hot water and take as a tea. But since he figured out that putting a cold room temperature water will dissolve better the powder, it just decided to take the formula as a cold tea. I said, no, don't do that. So that was a lesson that I learned, that what is obvious for us is not obvious for everybody. So be specific. Really tell your patient what needs to do and confirm that they understand. Let me see. Do you recommend vitamins? Yes. What vitamin brand do you recommend? I remember, guys, whatever I suggest here is what I think that's good for me. I tried other ones, but doesn't mean that there are not other good ones. There are other good ones there, but the ones that I use here are Design for Health, Zymogen from Whole Scripts, and Standard Process. Those are the three brands that I use the most. Whole Scripts is a platform that you can buy a lot of different brands, but they sell their own brand too, that is Zymogen. So again, it's Design for Health, Zymogen or Whole Script, and a Standard Process. Lately, since I treat a lot of functional nutrition patient, GI tract, and I'm doing a lot of stool tests with GI map, and I'm getting a lot of dysbiosis, I started using a few other brands for the probiotics, specifically for each kind of bacteria that I want to increase or decrease the amount on a GI tract, but mostly that. Those are the most important. I know the GI system is very important. Can you talk on more on a GI tract? What do you do? When I have a patient that has a GI tract problems, I really need to start fixing things from the beginning. I don't know if you guys are hearing this background. I'm sorry about that. Somebody's decided to do moving just now that I'm having a class. I'm sorry. First thing that I need to work on is about digestibility. I help a lot of my patients to understand what digestibility is and what they can do to get a better digestion, because everything starts on the mouth. So I have a document, a form that has all the little tips, simple tips that I will answer your question, Jennifer. Simple tips that you can give to the patients, like chew very well your food, because you have teeth in your mouth, but you don't have teeth in your stomach. Most of the people that has problem in the stomach for indigestion comes from not chewing the food very well. Don't eat in a hurry. Take the time to eat your food. Learn how to appreciate your food. Smell your food, taste your food, see your food, feel the taste, enjoy your meal. Don't eat under stress. I used to say that if you eat under stress, your stomach will digest under stress, and that doesn't work at all. It's pretty interesting, Jennifer. You are asking for the functional medicine education and certification that I recommend. I use a lot of from Oriental medicine principles in my functional nutrition consultation, because I think the beauty about being an Oriental medicine practitioner is, and working with functional nutrition, is because we can use principle of both. If you do any kind of functional nutrition class, you will learn a lot about that, but no one will tell you, for example, the best time to have your meals, because your stomach time is between 7 and 9. So you need to have your breakfast at that time because it's your stomach time. So it's really interesting when you start combining both things, the Oriental medicine knowledge, because most of the things that I do in my functional nutrition consultation comes from Oriental medicine. When I tell them what to eat and what not to eat, I never give them a meal plan, but I will suggest kinds of food that can help them with the conditions, which kind of principles I will be using. Chinese medicine, hot food, warm food, neutral foods, cold and fresh fruit and cold foods. So I combine both information to make sure that I'm getting the benefits of both information. Give me 1 second, people. I'll put in a mute here. I'm back. No, didn't cut. It was me. The noise was getting really loud here. No, I'm back. So what I do, I combine information from both things. I do a lot of classes in Coursera for those that want to learn more about functional medicine. There is so many other things that you can do. Okay, don't worry about, we cannot hear the noise. Oh, thank you for letting me know. I was so concerned about. Thank you. A lot of books. The one that I'm reading right now, I can't show because of the blurry things, but I get a lot of books in functional and nutrition. This is my passion. I just love nutrition, and nutrition was something that even in school, when I was doing my master's degree, I remember that the class for the food therapy class was one of my favorites. I just love everything that I'm learning from there. I want to know so much about that. And I knew that I could help my patient with that information. So, and when I started practicing, I started trying a lot of things with the patient. I was trying the acupuncture. I was trying the electroacupuncture, auricular, twina, you name it. But I was not getting the results that I want because most of them will have GI tract problems. So my patients, they were the one that drove me to the functional nutrition, because I keep getting patients that I don't have, that I couldn't get a good results. So I said, there is a missing piece here. There is a missing piece. And when I started analyzing the cases that I couldn't solve, this is the beauty about not being successful sometimes, people. It's learning from that. I started analyzing the case that I was not successful, trying to understand why I was not getting the results. And I learned that it was because I was not addressing the GI problems. So this is just it's a suggestion. And another thing that I think that is important, if you are in the beginning of your career as a Oriental medicine physician, look for a specialization. I chose mine. I chose functional nutrition. You will hear me talking about that for hours. I just love that. But this is my passion. Look for yours. See what you really like. See what you would like, which kind of patient you like to help. For example, there is another thing that I would like to help a lot, that is with emotional symptoms, disease that come from emotional problems, from anxiety, from stress, from depression. This is another thing that I love. And I would like to do a little bit more for my patients about that. So I'm thinking about adding another kind of therapy to my practice that I could add, that I could have more tools to help the patient. So when you are thinking about, in the beginning, you do everything. Actually, in the beginning, we do what shows up. We don't choose patients. We don't choose which kind of patients we will treat. But as you go, start looking for something that you love the most to do. Which kind of patients you'd like to be treating for the rest of your life. So this is when functional nutrition came to me. And you can do the same for you. You can choose what you like the most and start looking for resource that you can learn more, class that you can learn more, and you go from there. There is one more class and we are almost done here. There is one more question here from Michael. That was a pretty interesting question, Michael, and you will laugh on that. This American Board Certified Herbalist I got from my certification, from my master's degree that I got. I didn't do any extra classes on herbs. This is what my school offered to me when I graduated for my master's degree. So it was a certification that was available for me when I was done with school. So I didn't do what I know for sure is I didn't do any extra classes on herbs yet. I'm planning to do, but I didn't do yet. I hope that I answer your question, Michael. Donna, I am pretty much done. Do you have any more questions for me? Welcome. You guys have any questions for me? It's all good. And okay, hold on. This is my, okay, hold on. This is my information. You can reach me. This is the clinic phone here. For those that has WhatsApp, you can send me any questions on WhatsApp or text message. This is the information about how to reach me. You just the same way that I tell my patients, you have an open communication with me. If I don't answer right away, it's because I am with a patient, and later I will find a way to help you. Whatever you need, any kind of information that you need from me, that if I don't know, I will look for the answer. Just like I said, I don't have a lot of experience, but I'm learning a lot with the time that I'm practicing. So just reach me and ask whatever you want. I will do my best to help you guys. Thank you, thank you, thank you. Thank you for the support. Thank you for everything.
Thank you very much, everyone. And Sari, thank you so much for generously sharing your knowledge and taking the time to teach us all today. For our attendees, if you enjoyed today's class, we appreciate if you could share your thoughts on your social media to help promote both our speaker and eLotus. And as a reminder, the CEU quiz will be available tomorrow, and I'll send you guys an email when that's ready. Thank you again for joining us for today's webinar, and we're going to see you hopefully for our next webinar on August 26, 2023. Channel-based acupuncture strategies for treating pain with Mark Mastrandrea for an in-depth understanding of the channels used in acupuncture to treat pain for instant relief. We hope to see you guys there. Until then, have a great rest of your day and see you next time. Bye.